So we are live with the amazing Dr. Eniko Loud. So welcome back today, first and foremost. So we have today a live Q&A. Dr. Eniko Loud, she was with us a few months ago. We had a huge, tremendous response to her episode with us because she goes deep into like oral microbiome and everything that's happening inside our mouth and just how everything is connected with, the gut health, with the mouth. And today we're going to go even deeper, and she has shared some resources with us with with tongue, and specifically what the tongue says about your health. So it's going to blow your mind. When I was looking at the pictures that she sent me, I was like, "Oh my goodness gracious! I don't even know these things." So I'm excited to learn from you, Dr. Loud. Welcome back. Thank you for being here.
Thanks for having me. This is fun.
Oh, it's so fun. So for those of you who do not know or have not listened to our previous episode, we'll make sure we link it below. But Dr. Eniko Loud is a biological dentist and founder and medical director of Whole Health Dentistry in Phoenix, Arizona. She's a rare expert blending functional medicine, trauma awareness, and dentistry to help you decode what your mouth is really telling you. And that's what I love, because what she shared with me earlier, it's this tongue map, and it is, definitely like a decoding system. So if anybody has any questions live, start dropping those in. Let us know where you're tuning in from, and we will do our best to decode it all together. So Dr. Loud, for those who do not know you and follow you, anything else that you want to mention just for people to know who you are before we dive in?
Just one more thing that I'm working on is I'm training in Ayurvedic medicine, which is kind of like Chinese medicine, but a bit older and much deeper. And kind of how we bring together symptoms, signs, the intelligence of nature, circadian rhythms, the intelligence of the body, and the unique energetics of a mental, emotional, physical makeup we all have.
Incredible. So I know, you're always learning, and that's what's so great about you. You're continuing to evolve and add on to your practice, and what I've been to your practice before, just the tools, what you give to your patients, it's not your typical dentist experience, that's for sure. So, but you also see patients, all over the country. Is that correct?
Yeah. People come in from all over.
Great. So if you are interested in seeing her in Phoenix, Arizona, you can head on down there. And then she's a wealth of information here inside Life Network, being a core contributing expert for us. So excited to dive in deeper today on some of these questions that are coming in. So Dr. Loud, we have a couple questions. I'm just going to pull these up here. So we have one from a Life Network member, and she says, hang on, let me get this one pulled up, and I'll actually put it on our screen too. But okay, so thank you so much for offering your advice, Dr. Loud. I have jaw tension for sure. I would love to hear about ways to relieve that. Also, my dentist is recommending crowns for my last two upper molars on the right side. The right side has the most tension because I chew on that side due to missing the two last lower rear molars on the left side. While the teeth they are recommending crowns for have started to look like it's time. I'm 63. I've hesitated because of jaw pain. Do you have any recommendations?
Well, you have tremendous insight, because when you have a lot of tension and jaw pain, you have to be really careful about how you work on those back teeth. I'm sorry, my older dog, she's a bit dementia.
That's okay. I love dogs. We all love dogs here.
And so yes, you have tremendous wisdom there, because you have to want to question why are they wanting to crown those teeth? What's happening with them? Because if you think about it this way, when you close, anybody that closes, you'll feel your back molars first. And these muscles are very powerful. Like, you can bite somebody's ear off, like Mike Tyson did, right?
Yeah, exactly.
These muscles. Man. And if those muscles are out of balance, those back molars, the very back molars, are going to be overloaded.
Okay.
And one of the signs is tension in the jaw, especially when you wake up in the morning. The other signs could be that those teeth can crack. What I have seen, and this is known in dentistry, is that if you try to crown those teeth, for example, shave off maybe at 1 or 2 millimeters, if those teeth under pressure, they will decompress immediately, and they will fall down in 1 or 2 millimeters.
Okay.
And what? And then it turns into a whole ordeal of big problems of jaw pain. So
right
before they address those back teeth, the jaw tension should be addressed first.
Okay.
And also, you'd want to know what is wrong with the teeth exactly. Are they showing signs of stress? Because that could be because those teeth are overloaded. So those teeth tend to overfunction. They kind of turn inward, and they're usually the main reason for jaw tension and jaw pain.
Okay.
So kind of addressing the crowns without addressing the jaw pain, it could create even more problems. So
Interesting.
that's for her to find someone that could truly see, are those teeth the cause of the jaw pain? Are those teeth showing signs of stress and cracks because they're overloaded? And then figure out, based on the root cause of those issues, of how to fix it best.
Okay, that's really good advice. And then stress is linked to a lot of that clenching, right?
Yeah,
as well?
especially women, we hold a lot of our emotions in our jaw. And in these more ancient cultures, it has to do with not speaking our mind also, and just kind of holding the tension in that, like holding our words back. That's something that could be explored there.
Okay.
But it could also be just a simple mechanical issue, because our body is a mechanical system that functions perfectly in harmony. And when a sign of jaw tension happens, it could be a sign of imbalance, mechanical imbalance.
Okay.
It could be neck posture of how somebody's sitting at the computer for long periods of time, or looking down at their phone, or not really using the neck muscles properly. So all that transfers upward.
So because of the day and age that we live in with our computers and phones, everything is out of alignment for most people. Are you noticing more of like an epidemic of people coming into your office that are having those issues? And that makes sense with, is it just like weakened muscles here because it's not in the correct alignment, or
mostly imbalance because we don't activate cross-body activation? I know Ben talks about that. And then fascia, ligaments, they don't get released regularly. And we don't manage our physical energy properly. So we get overstressed, then hold a lot of tension, and we don't take time to release it. And that's why stretching is so important. Cross-body stretching like yoga and Pilates and these practices really focus on deep fascial release, which is very important for the neck. Because the head is, the whole body is just suspended downwards, and gravity is working against us.
Yeah, that's so true. Yeah. And Ben does talk about that quite a bit, in moving our bodies in all planes of motion.
Yeah.
And because we're so much in a forward direction, just one direction all day long. So you'll see, Ben will do like walking backwards and all these interesting, weird things, but it does make sense though.
Yeah. Yeah. And just like taking time to stretch, relax, and then breathe into those areas of tension. And maybe this is one of the things that I'm developing the biointelligence program, is ask your body, what are you telling me? Because the question was great, which means that you're already in tune with your intuition of what could be going on, and you're questioning, why would I get the crowns if I have this? So yeah.
Okay. And I love that you're getting this deeper dive with your training. You're already just an amazing, smart dentist. And, but that's what I love. Like, our body is telling us, it's talking to us every single day. And it will start as a whisper, right? With something wrong. And then it gets louder and louder if we're not listening.
Yeah.
So the fact that, Julie is listening in right now to her body, and there's some tension and pain, and she's tuning in. But like you said, it could be, either stress, but more of a mechanical issue as well. So
also, yeah. And kind of explore that with the dentist, and maybe find a jaw joint specialist or a TMJ specialist, or a bioaesthetic dentist who are trained in the biomechanics of the jaw and determining the root causes of diseases, which usually one tooth out of alignment, or like what she was saying, she started chewing on only one side. So that's that side automatically and making the muscles not contract evenly. So now everything could be just moved to that side. And when we only function on one side, the whole body reacts to that. Like the hips could be tight, the knees could be a problem on that side.
It's just a whole chain reaction that goes down.
It adapts to us doing something sideways.
Okay, that's interesting. So I don't remember if you remember my story too, but so I had TMJ as well, and I had like lockjaw, and I had a device or mouth guard, not necessarily a mouth guard, whatever, so to prevent me from clenching, because it would just literally lock up in place. And then I ended up getting like oral candida and just nasty gut issues too. Yeah. So I kind of want to go into that with the gut connection. And, obviously I think mine was stress. I don't think it was a mechanical issue, but I don't remember it. That was probably like 7 years ago now, but I do still wear that guard because like you said, like it's a lot of it is just stress. And as a woman, we are holding things sometimes. And then at nighttime, that's when our body just kind of like, let's go, or
let's release.
Yeah. So can you talk about that gut connection then, like what that means?
With appliances or just the mouth gut connection?
Just the mouth gut connection.
So the mouth being the first part of the gut, it has the same lining as the gut. So our body's so intelligent that it allowed us to have a window into the body. So anytime we have any type of imbalance in our gut, it automatically shows up in the mouth. And that's why I created that the little diagram and the questionnaire where you could kind of see based on what your symptoms are or what's happening, how that could be connected to things. But yeah, so if you have candida in your whole system, that can also show up as a white coating in the back of the mouth, on the back of the tongue, or like sweet cravings or sweet taste in the mouth, because candida likes sugar. It thrives on that. So just if you have more of a sweet taste when you wake up in the morning, or for example, you feel like excessive salivation or even nausea in the morning, your system could be bogged down with things like candida or heaviness. The body, it's like clogging the body.
Yeah. So paying attention, again, your body's talking to you. So if you are noticing any kind of white coating, that's not good.
Not a thick white coating or chunky white coating or coating that you can't really scrape off easily. Looks like a deep-seated stagnation or some type of overgrowth of some sort. Also, the saliva we have in our mouth contains trillions of bacteria. And we swallow our saliva because that's just natural because it lubricates the food. If somebody takes these antacids or has low stomach acid due to slower digestion or stress, or because stress is destructive, right? So it just uses our resources to make energy, but not digestive enzymes. Then you can see the changes in the mouth also. More dryness, more cracking. So when we swallow these trillions of bacteria and we don't have enough stomach acid, it actually ends up going into the small intestine. It can the balance of the microbiome in the stomach, and then the small intestine can contribute to small intestinal bacterial overgrowth.
Yep, SIBO.
And then I learned that the flora in our lungs is secondary to the flora in our mouth because we inhale through our mouth. So then the bacteria that live in our mouth also populate our lungs. So like oral health is key to lung health also. So somebody's struggling with a lot of upper respiratory infection, so they get colds easily, then they really need, or like their tonsils swell up or sore throats, really need to examine the microbiome of the mouth.
Okay. Lots going on. But it's like a window into things that you can see. So someone did kind of ask on this, and you mentioned, you talked about this already, but it says, how do I know if my tongue shows inflammation or gut imbalance? Is there any other signs other than like cracking, the white coating that won't go away?
So especially now since it's summer in most places and it's hot, there's a tendency more for heat to build up in the body. If we don't eat cooling foods that can kind of balance the energetic makeup of our body. So somebody could see more redness on their tongue. And one sign of inflammation is a swollen tongue, like a tongue that's bigger. So like when you stick your tongue out, it's really big and fatty, or there's like they're like indentations at the edges of the tongue, and that could be a sign that the tongue is getting too big, or there's also malabsorption in a small intestine.
Okay. Wow. Like you said,
prediabetes, one of the signs of prediabetes is an enlarged tongue. Also,
really?
thyroidism, like somebody has high thyroid hormones, the tongue, it becomes a bit fleshier and more swollen, more red.
Okay. So that's another sign and signal to look out for. So obviously when when people go see you, you're probably thoroughly inspecting the tongue for all of those signs. And you could probably spot things way sooner than maybe they would if they're not paying attention.
Yeah, so if somebody drinks a lot of alcohol, that creates a lot of inflammation. Their tongue is going to be really bright red, especially maybe at the tip of the tongue where the stomach and the heart.
Okay, interesting. So are there any, certain patients that stick out to you where like maybe it was like a big red flag and somebody you caught that, maybe soon and you helped them get on the right track that you can remember?
I remember a patient of mine that I saw maybe a couple months ago. His tongue was purple, like purple. And that's a really severe sign of hypoxia. Like he did not have enough oxygen. He was already having sleep apnea, wasn't wearing his sleep device or sleep apnea device. You correlate with that. He was breathing pretty heavily. He was overweight, but that's a sign that there's deep lack of oxygen in the tissues because the tongue is purple. You might not see it on the skin. That's long-standing oxygen deprivation.
Wow, that's super scary. Not anything you want to mess around with. So I'm sure
should never be purple.
No.
Kind of grape juice or something.
Yeah, right. That
purple stuff
that stains it. Yeah. Well, I'm sure he's very grateful that you caught that for him and heading in the right direction. We did have another question, kind of piggybacking. Still, can oral care affect my digestion or brain fog? So we kind of talked about digestion a bit, but what about brain fog?
So brain fog is very much correlated with oral care because I don't know if you've heard of LPS, lipopolysaccharides. So bacteria they produce these toxins that enter the bloodstream, and they can create inflammation just like that. Okay. And brain fog is one of the signs of brain inflammation. And there's strong correlation between certain types of bacteria like P. gingivalis or PG and Alzheimer's dementia. So yes, bacteria that live in our mouth. And if we don't floss, so like somebody doesn't floss and brush regularly, these bacteria just build up on the gum tissues and the teeth, and the food we leave behind for them acts as fuel for them. So they eat, they produce acids, they produce these LPS and toxins, and then the bacteria have an intelligence because they have to live off the tissues of our body and the food, and they start producing inflammation. Immune system recognizes it and tries to like ward it off. So more blood vessels come to the area, and the bacteria now penetrate the blood vessels and go through the brain. The mouth is the closest to the brain, and there's direct vascular connection. So these bacteria travel to the brain very easily, and they can correlate with brain fog. Also, another thing that's really not talked about a lot is if somebody has different metals, crowns, or mercury fillings, or different titanium crowns, titanium implants done at different times, that could create a dissimilar metal effect and create a battery effect between those metals that can interfere with neurological impulses, like nerve impulses. So that's something, it's called a galvanic effect. Okay. That's something that can also interfere with brain function.
So what would you recommend for that person who has those?
Really have them evaluated and maybe replace them with ceramic crowns, so there's less of a chance of that happening. Or, if you have just one metal crown, the chances that cause problem is minimal. But if you have gold and other materials, it's just a mishmash of materials that could cause problems.
Okay. So being evaluated by
like a biological dentist or holistic dentist that understands that concept is important. And with that, we're removing mercury fillings.
Yes. In a safe way, right? Because there's places that remove them in other harmful ways.
So that's a really good question there, because there should be a preparation phase also for mercury filling removal, because if somebody has a weak immune system and they're dealing with a lot of infections, because mercury is a breeding ground for bacteria, that should be addressed first. Somebody should have normal vitamin D levels, vitamin A, D, E, K, really intact gum tissue, no leaky gums, healthier gut. And so just the immune system and their overall strength and stamina should be decent before they undergo such procedures, because we don't really understand, even if we isolate really well, the patient is on oxygen, I still believe that there might be some tiny particles that could escape, and that could be just like a trigger for somebody that's already, or like the tipping point for someone that's dealing with a lot of issues.
Okay, that's a very good point.
Joel Huggins had really good protocols about this.
Okay.
And the Institute of Functional Medicine has really great protocols, and I can email those to you too, so you can make it available.
Yeah, we would definitely post that because I know some people do have mercury fillings still, and maybe they're just afraid of taking them out because of like you said, like they do have to be done in the right way, but then also getting your body ready to take them out.
Upregulating detox pathway, making sure that those are healthy. The gut can handle it, like glutathione. There's just a lot of things that you could do beforehand and even after to keep your body in this nice detox rhythm and strengthen it instead of weaken it.
That's incredible. Okay, great. Yes, we would love to share that that resource whenever. We'll connect later on to get that available to Life Network members. And then to go back to the flossing part, and like you said, because people are like, yeah, I floss sometimes, and it's just to get the food that's stuck out of there. But I love what you touched on because I was not the best at flossing myself, and I'm speaking to myself because I'm like, oh, I'm just too busy and I'm fine. But the connection with the brain, and I had heard something about when you do floss consistently, you're helping to prevent dementia and Alzheimer's. Is that correct?
Yeah, that is correct. Because so we might brush our teeth really efficiently, but the teeth are like together, like a picket fence. And the area that's most vulnerable to bacterial attack is the space between the teeth, because that gum tissue has a bit of a different structure. It's much more permeable. So if food stays in the spaces between the teeth, then it putrefies. It just becomes just junk. So if we leave it there, bacteria love it. There's like, hey, you left me food here for me to party. And then they produce these LPS, these toxins, they invade the gum tissue. And then through that invasion, you constantly, everything you eat, everything you take in, those bacteria just going straight to your bloodstream.
Wow.
That's microscopic. It's very subtle, so you don't notice it. But we have patients that don't like to floss, and we check the bacterial levels in their mouth. Although their gums on the outside, they look healthy, but in between, there's some bleeding. Even 1 or 2 sites of bleeding, it's enough for these harmful bacteria to enter the bloodstream. So in these patients, sometimes we see really elevated levels of these, like P. gingivalis, the ones that enter the brain, or heart disease correlated bacteria, or gut, colon cancer related bacteria. So the safest thing is to do is just floss at least every night. Okay. Because at night we don't make as much saliva. So our saliva is bathing. It has antimicrobial properties. It digests the carbohydrates. It should be more of a neutral pH, like about 7-ish. But at night we don't have that. Our body goes in resting and restoration and rebuilding. So at that time we're a bit more vulnerable to these attacks.
Interesting. Okay, so not only doing your flossing just because your dentist tells you, but it helps prevent brain fog, like we talked about, and then just your body preventing dementia and Alzheimer's as well. Like, I think that's incredible.
The way I tell patients to remember it, it's like, not flossing is like, it's like showering and not cleaning your armpits or your crotch.
You're leaving out
a small percentage of your hygiene, but if you did that every single day, or like you didn't wash your armpits for like a week, or but it would be so pretty, right?
Pretty nasty. Yeah. That's a good analogy.
There's a lot of hidden places that you have to get to.
Okay, yeah, because it's the little right in between there. So then what you're looking out for is if people have, blood, obviously, even if it's a little bit, right? And then some inflammation
is one of them.
Bad breath too.
And I also suggest patients that, so do an experiment on yourself. Don't floss for a whole week. And then at the end of the week, take the floss and then smell it. It's going to smell pretty darn bad. So that's like showing you what's happening in those spaces when you don't clean them.
Oh, wow. Okay, that's a good one. And you could probably tell right away the people who floss and don't, right? I'm sure.
Usually, yes. Yeah.
So actually, someone did actually ask about bad breath too. So I was going to pull that one up. Why do I still get bad breath if I brush? So it's because they're not flossing? Maybe.
That's a really good question. So it could be from lack of flossing, yes, or lack of flossing properly. So removing everything. It could be from the tongue, and it could be from the tonsils, or even the nose, or even the stomach. Yes, like H. pylori infections in the stomach or indigestion in the stomach, it could come back. The question is, when do you feel like you have bad breath? Is it like when you first wake up in the morning? That could be more from the mouth, the sinuses, or the tonsils, and or when you're hungry. So when you're hungry and you haven't eaten, that could be coming from the stomach also.
Okay, interesting. So it's many, many things, and it's not something to be ignored. Like you want to listen. Again, it's another way your body's talking to you.
Yeah, it could be a cyst inside the sinuses, some kind of mold or some type of candida in the sinuses that creates that smell that the patient has, but maybe nobody else is smelling it, but they're smelling it. So those are like things to kind of look deeper. Where's this coming from?
Okay, interesting. And then what are your thoughts then on the new floss electric ones that they have now? I think I think it is electric and it has like a little floss attachment. Have you seen those?
I think those are great. Yeah.
Okay.
Whatever tools work in one's hands to, create the healthy microbiome. The other thing that could cause bad breath is even if somebody's brushing, flossing, tongue scraping, and tonsils, everything is good. It could be an imbalance in the microbiome in spite of all the cleaning that they do, and that could be a reflection of the whole system. So, like the body could be more acidic, and then the way bacteria process the food, in that acidity, there's an overgrowth of more acid-producing bacteria that could produce gases. So like doing the microbiome test, oral microbiome test, that could be, we call it SWISH, or Oral DNA Labs has really good testing. Those are good. Yeah.
Do you have those listed on your website, like certain tests that you recommend for people to get?
I do. I think I need to add the SWISH and the other one. The only thing is that you have to do it with a dentist, because if you just do it on your own, and there's nobody there to guide you of what to do with it or looking deeper into what could be causing it, it doesn't have a whole lot of use to it. One way to rebalance the microbiome, there's a couple hacks. So I recommend patients to use biocidin products. It's an herbal product. Biobotanical Research is a great company, and there's lots of studies in how over a period of 6 to 8 weeks or longer, they rebalance the microbiome without killing off the good bugs. And I've had great success when somebody had overgrowth of bacteria and bad breath. Like within a week, bad breath went away of using the dental cidin toothpaste and rinse morning and at night. It works pretty quickly. So that's a good way. And then the other way is to freshen your breath is cardamom pods. They're antibacterial. So these green cardamom pods, you can put them in a little tin or a little baggie, and they have little seeds inside of them, so you could chew on that. That can rebalance the microbiome and increase saliva production too.
Okay. So is that something that you make on your own, or is something that you can buy somewhere?
It's just buy at the grocery store.
Okay. Like, where would you find that?
Spice aisle. They always have the cup.
Okay, cool. So is that a better swap then for somebody who likes like mints or gum?
I totally believe, it's much better.
Okay.
There's no synthetic anything in that, especially if you buy cardamom pods. And it tastes a little bit like licorice, and it's very refreshing.
I'm gonna have to try that. I've never tried that one. And then for the biocidin, the mouthwash, is it a mouthwash or just like a?
So dental cidin toothpaste, and the rinse. The rinse is like a small little pump. It's more of an oil pulling rinse. So you put a couple pumps to your mouth, swish it for at least a minute, and that acts as an oil pulling rinse. But it is all kinds of things that help strengthen the gum tissue also.
Okay, good to know. And then for somebody, is that good for anybody to use that type of rinse? And
yeah, it's good for anybody. Oil pulling is really great for anyone.
Yes. And then I know probably just from, listening to Ben forever too. And, but can you remind people who might be using, say, like Listerine as their mouthwash and why that is not good for you?
Well, it's enough to look at the ingredients on the back of the bottle and see all that's in it that shouldn't be in your mouth. And if you go look deeper on their material safety data sheet, you'll see like there's things that really have nothing to do with the physical body that should be safe. But there's alcohol in most of it. Even the alcohol free has coloring agents, detergents, some other things that can disrupt the oral microbiome. And the goal is not to kill the bacteria. It's the goal is to rebalance it, like help the body rebalance the microbiome. Because if we kill it, then it's the whole intelligence of the system is lost, and it takes a while for it to come back.
And that's usually with any type of alcohol-based.
Alcohol is not good for the mouth because it's drying, irritate the gum tissue, and also it just kills the microbiome indiscriminately. versus these herbal products. Herbs have an intelligence, and they know how to work with the human body to rebalance and not just kill off things randomly.
Okay.
Same thing goes for, shoot, I want to say it. There's this whitening products. Yeah. So like with lots of whitening. The whitening, I often see patients come in and I already know they're using whitening stuff because I can see the inside of the gum tissue peeling off. So there's like chunks of, soft tissue that I could pull out.
No way.
Yeah. So if you wake up with white deposits at the corners of your mouth, that could be like an allergic reaction or like a too abrasive or aggressive of a chemical product in that toothpaste that you're using.
Interesting. Okay. So whitening strips as well, but are there some that you would recommend for somebody who likes to do an over-the-counter?
There's so many out there. I really like coconut charcoal. It works pretty good at whitening naturally. And then the newer hydroxyapatites, the microhydroxyapatites help also whiten. But yeah, probably coconut charcoal would be the most natural and kindest. A lot of other things have a lot of chemicals in them. The black coconut charcoal, the white coconut charcoal, those are all pretty decent.
Okay. Is that a specific name brand or just look for that ingredient?
Just look for that because there's so many out there that, Wellness has a lot of great products too. They most hydroxyapatite for whitening. They have pretty clean products.
Okay. Okay. Good to know. We'll make sure that we link those below too, because I know there's, when somebody first starts heading down that path to better, the ingredients that they're putting into their body and the awareness of it, is where we start. But like, where do I start first? And there's so many things that we can change and it gets to be overwhelming. But just start. What would you recommend to the person who's like, where do I even start? I'm doing all things wrong with my mouth. Where should I even?
It's really finding. I think the biobotanical research, those are great products, and just Dr. Tung, Tung's floss, I like that. Just having a clean product for brushing and flossing, and just having that morning and nighttime routine. That's a good one to start with. And in the morning, if you could add tongue scraping most of the days, that's already a good start.
Yes. I love tongue scraping. I've been doing that for, I don't even know, probably like 6 or 7 years now. And I can't go a morning without it now because it feels weird if I don't. Is there better tongue scrapers out there? Like, because I've seen copper ones, and is it silver or I don't even know.
Yeah, copper is the best because it's antimicrobial.
Okay.
That would be the best one.
Okay. Good to know.
And but I like toothbrush is not a good idea because even a spoon is better than a toothbrush. So if you don't have a tongue scraper, you can use your spoon.
Interesting.
Right. But the toothbrush, when you wake up, your body detoxes at night from 10 p.m. To 2 a.m. So it's dumping toxins in the gut for eliminations. That's why we poop in the morning when we first wake up. And it dumps it in the mouth also. So if you use your toothbrush and you push the toxins into your toothbrush, and then that's a breeding ground for bacteria. So you really don't want that.
Yes. Okay. So don't do that. But I do like what you said too, because it can be overwhelming. But if we just start with brushing, first thing in the morning and,
and I need for 2 minutes. You shouldn't feel fuzziness on your teeth after. You should really take your time to like brush every side of the tooth. If you can brush for more than 2 minutes in front of your red light, which most Life Network people probably have.
Yeah. Yep. Same too.
Like habit stacking, what is one thing or while you're prepping your coffee or whatever you're doing, you could be just really taking the time, paying attention to brush every side. Most people forget to brush the inside, like by the tongue.
That's what I do. Yeah, I forget.
And, that's important to kind of clean that area because that's an easy place for that's where I see most of the inflammation in people is the tongue side of the lower teeth.
Okay. Because we're not spending enough time.
Yeah, we're just thinking and not brushing. So being present for those 2 minutes with your mouth with the toothbrush, that's like a good little meditation break.
Yeah. Yeah. I mean, we're all about, habit stacking here for sure too. But at the same time, if we're going to stack it, it needs to be something where you're not having to think about the other thing too, like sitting in front of the red light and maybe just breathing.
Or like gratitude practice for your teeth and for your mouth that allows you, interface with the environment and speak
like that
and digest and take in the
Oh, that's beautiful. That's a great way to think about that. I have not incorporated gratitude practice into my toothbrushing, so I will have to do that. I will stack that on tonight when I brush my teeth and think about you too. That's good, Dr. Loud. Thank you for that. Okay, so another person is asking, is there a right age to start holistic dental care?
You can start it any day.
Yeah, I would imagine.
I read somewhere yesterday, I don't remember who wrote it, but oh yeah, it was Buddha actually, that where we are today is an expression of our past action, what the future is, what we decide to do today. So it doesn't matter where you've been, and if you haven't done holistic things, the body remakes itself every year, like whole new cells, everything new. So wherever you start, it's a good point. You're never too old to do things for yourself.
So true. It reminds me, maybe it's Benjamin Franklin who said this. I don't remember, but the best time to plant a tree was 100 years ago, but the second best time is today, right? So it's, just start now. And if you, obviously, like you said, like start holistic dental care, like ASAP as soon as you can with your children. But if you haven't, then, make the next appointment, a better choice.
Exactly. Yeah.
That's good. Okay. So then for kids as well, though, someone is asking, is mouth breathing really harmful for kids?
It is very harmful. And the reason for that is, if you think of it this way, our nose is meant for breathing, and there's two small holes here. And these two small holes, when you inhale, it creates resistance, and it creates like increased negative pressure in your lungs. So your diaphragm has to become stronger. And the diaphragm is something that stabilizes the chest. So it's like it expands, it contracts, but it controls the function of internal organs also. So if somebody is not breathing through their nose, they're breathing through their mouth, they'll have shallow breathing, and the diaphragm will lose its complete function. So then it could lead to digestive issues, respiratory issues, because the diaphragm is not moving the organs, it's not expanding, contracting. Most people know this, I think, in your group, that nitric oxide is very important. So our nose makes a significantly more amount of nitric oxide, and the mouth does not make that much. So nitric oxide helps with relaxation, blood flow. And children that breathe through their mouth, they tend to have more anxiety, more attention deficit disorder, more respiratory issues, more immune issues, because they're not getting the nitric oxide, and the diaphragm is not doing its proper action.
Okay.
We can end up with back pain, especially low back pain, because this diaphragm is a huge muscle that stabilizes the spine also.
So what do you do then if you find your child or yourself is doing that?
There's a really good book by Patrick McKeown. I think it's called Close Your Mouth. Mm-hmm. It's a really good handbook for parents that you can use to help your children learn to breathe through their nose. Also working with a myofunctional therapist, trying to figure out what's going on with their muscles in their mouth, their throat, and their tongue that's causing that, or if they have tongue tie, or if the jaw is underdeveloped. Oftentimes, mouth breathing could be caused by enlarged tonsils, which could be caused by gluten or dairy sensitivity in these children.
True.
Especially dairy. And so there's a lot of things that can be looked at. Myofunctional therapists are usually really good at it. Kat, who is my myofunctional therapist, who was on Ben Greenfield's podcast, her site is called Honest Myo. She has lots of free videos for people to on her YouTube channel that people can see and get information about the mouth and children.
Okay. Perfect. That's great. We'll make sure we can link that as well. And we'll link Ben's episode with her too. But what about then mouth tape? I mouth tape myself, but.
Yeah. You have to be careful with children because they have to be able to breathe through their nose, right? Mm-hmm. So like nasal unblocking exercises are important. And just making sure, I would try that daytime to see if they can tolerate daytime and how they do with it as a training device. You just have to make sure they don't have enlarged tonsils and, like adenoids or problems with their nasal cavity, deviated septum. So it's safe to mouth tape.
Okay, perfect. That's good advice. I've caught my children sometimes when I've walked in on them and in their room just to check on them, and their mouths are wide open. I'm like, oh my gosh, how do I stop that? So
I notice when children, I watch this at the airports, when they're absorbed in their iPhones, so they tilt their head down, which obstructs the airway. and
Mm-hmm.
then they start breathing through their mouth because their airway is more obstructed and their jaw falls forward. So maybe watching children when they're on electronic devices to be looking up, because then there's a better chance that the mouth will stay closed. And then making sure their mouth is closed when they're focusing on a task. Because if you retrain them during the day, there's a better chance that the mouth and the muscles will remember that at night.
At night.
So again, working with a myofunctional therapist, it's really important.
Okay, that's great advice. Thank you for that. Super helpful. We had another question come through on, do you ever see emotions held in certain teeth?
That's a really good question. That's a big topic.
I would imagine that might be a big that.
Yes, I am pretty sure of that. But it's not very scientific, right?
Yeah.
There's and this is something I'm still learning about. In Chinese medicine, there's the meridians, and each meridian is connected with the organ, and every organ is connected with certain emotions. Like lung meridians could be related to grief and holding on to things and sadness.
Mm-hmm.
So every meridian could be. I think that's kind of how they're more connected. On my website, there's a tooth chart as a Chinese medicine tooth chart where you could click on each tooth and it gives you the organs and the emotions that could be connected with it.
Oh, wow. Okay. We'll link that as well. But like you said, this is a pretty lengthy topic too. So you can save this for like a part 3.
The brilliant questions, I think, has to do a lot with how the organs are connected through meridians, because 600 meridians run through the head. And those can be definitely connected.
I know last time we talked, you were, thinking about or potentially going to work on one day, like some type of master class of sorts, to kind of spin off of what you're learning with your Ayurvedic. Is that still something in the works for you?
It's in the works. It's coming.
Hey, I would imagine it'd be a long process to do that.
It's called the biointelligence program. It's like how to reconnect and decode the signals, then recode them, know what to do when, and then just live, be our own healer, and understand that we have that power to heal ourselves.
We do. Yeah. The body is miraculous and it is designed to heal itself. But a lot of times we don't either know how to do it, or it's just completely blocked, or because of the damage that we've done to it.
Yeah.
Okay. Well, good. Well, I can't wait to hear when's that. When do you think your timeline for that is?
I think probably about December. It's a big plan.
Okay. Well, sounds good. Well, we will be in touch when that is live and make sure we can link that out so people can learn more about how to take that course. So I'm very curious about it too. Okay, so I would love to, we have a couple rapid fire questions I kind of want to wrap it up with, and be very mindful of your time, Dr. Loud. This one kind of, we've touched on a little bit, but for you specifically, what is your daily oral routine?
Oh, thank you. So I wake up in the morning, and then the first thing I do is, I use actually eye drops, specific rosewater eye drops to cleanse my eyes. Then I use a nose oil to cleanse my nasal cavity. And then I use tongue scraping and oil pulling. So it's recommended that you floss and brush right after that. But I usually do that after I eat my breakfast, because, toothpaste always changes the taste of breakfast. So
I know I do it afterwards myself too. I don't like to do it before.
And I use oil pulling too. So after I tongue scrape, then I oil pull, and then I do my meditation, and then eat breakfast and come back to pleasant brushing.
I love that. That's great. So for your oil pulling, are you using the Biocidin rinse, or are you using?
I use that, and I also use something that's an Indian recipe from Kerala Ayurveda. I can send you the link to that.
Yeah. Oh, please.
That's really, really great for oil pulling and gargling, activating the vagus nerve. And then to kind of complete that at lunchtime, after I eat lunch, then I brush my teeth, and at night before I go to bed, I also floss and brush every night.
Okay, perfect. And I love how, did you say like gratitude and breath work also in the morning and evening that you're doing too?
Yeah, and at night I usually brush my teeth probably about 4 or 5 minutes in front of the red light, really close to it.
Okay, at nighttime, and that probably just calms the body as well for sleep.
Yeah.
That's incredible. Okay, what about the electric toothbrush brushes with red light? Have you seen those?
I think I've seen them. The only thing with that is a lot of times you can't really find information about the wavelength of the light, and studies that actually works, because they can just put red light of any kind, and who knows what kind of wavelength it is or how deep it penetrates. So that's the only thing that I found with those versus the professional devices. those actually have a lot of data and science behind the wavelengths that they use.
True. Okay.
But, I mean, I don't think it can hurt.
And then what's your toothbrush that you use?
I use Oral-B. I love Oral-B, the professional series. And sometimes I at work I use manual, and at home I use the Oral-B.
Okay. All right. Well, good. I always love to hear from the expert what they love to do at home. It's super helpful. Can you tell me though, also, I'm curious about the eye drops and the nose drops that you're using. Is it just an essential oil, or what are you doing?
So the eye drops is it's a rose water based eye drop that helps cleanse the eyes, because eyes are they need cooling and cleansing regularly. And the nose drop, and all these are Ayurvedic remedies that I learned. These are like so 5,000 years ago they laid it out. These are the daily practices you have to do every day. Wake up, drink lemon water, then tongue scrape, oil pulling, but you start with the eyes. So you start with cleansing your senses. You cleanse the eyes first with this rose water drop, and then you cleanse your nose with these special like sesame seed oil herbal nasal drops that helps like kind of open up the pathways to your brain. And then the mouth pulling, oil pulling. So they go downward like this, cleansing out.
Just to kind of drain out through the body.
Yeah. Okay. Yeah. Oil pulling is great. You know, we have so much pollution in our the nasal drops because there's so much pollution and dryness, especially in the summer. It helps open the nasal passages.
Okay, that's good. And then are these two things something that you're making?
I'm not making. I'm getting it through the same company, Kerala Ayurveda, and they have really great products.
So many resources, as always. I can't wait to look these up and get some for myself, because I have dry eye and I'm always putting in eye drops, but I'm sure the ones that I'm using are not good.
Yeah. I'll send you the links to all of them. There are different ones that I found in different places that are really high quality or organic, and they really do work.
Okay. Well, good. We did have one other, thank you, Dr. Loud, a question that just came in also, and I want to make sure that we touch on this one because we did talk about not brushing teeth. And this person says, Dr. Barbara says you shouldn't brush right in the morning because your mouth has B12, so you should wait. Is that correct?
I need to learn more about that.
Okay.
I think, if I just rely on a B12 in my mouth, I'm not sure. But
yeah. So, but like you said too, like even it changes the taste of the food that you're eating. So maybe just off after you're done.
And Ayurvedic texts, they recommend, like these ancient sciences, they recommend oil pulling, flossing, and then brushing your teeth right after. But then again, back then they used to use twigs to brush their teeth. So I don't know, and there were herbs. So
yes, that's a very good point. Oh my gosh. Okay, well, good. Well, I'm curious to learn more about the B12 part too. So. We will look into that. But okay, so then lastly, what is one oral product that you would never use?
I don't know. Probably Listerine.
I was gonna say, yeah, we've already touched into that, and yeah. So get rid of the nasty mouthwash.
And then Glide too. I'll add that to it. Glide.
And yeah, tell me why. I had heard that before too. Why is Glide bad?
Teflon on it, and then it has petroleum.
Okay, and that's nasty. Like you're putting
some other chemicals that you don't want in there, like the waxy stuff that they put on there. That's all. Normally we don't use Teflon right anymore, so
no. And petroleum in your mouth sounds nasty. So we definitely don't want to do that. So, oh, good. Okay. So Dr. Loud, that was absolutely incredible. We blew through so many questions, and I will make sure that we link, the resources that Dr. Loud had sent over to me as well with the tongue map. And we have a couple PDFs that we're going to upload to Life Network later. But is there anything else that you would like to leave our listeners with, or anything else you'd like to share?
This is a quote that I have in my office. Smile like you still have your teeth.
Say that again?
Smile while you still have your teeth.
That's cute. Yes. Because when we get older, who knows what's going to happen.
Yeah, no, just keep your teeth. So keep smiling.
Oh, keep smiling. That's so good. You never know who in your day today might need your smile. So.
Exactly.
Yeah.
It's free.
It's free. It's so true. Like I always think about it's just those little things. Like every single person that if you walk past that person, you smiled at them, like you might have made their day.
And they usually smile back. That's one thing I love here in America. When I came here from Europe, people were smiling at me in the morning. I was like, what's weird? Because in Europe, we don't really do that. And then now I smile at people. They smile back when I go to Europe, and especially the country where I'm from. I smile at people. They're like, what's going on?
Yeah. You're like, this is so weird.
But people usually smile back, and it's a beautiful thing. Just to
it's
smile.
So true.
No matter what's going on.
Yeah. Like you said, it's free, and the person might need it more than you know. So
the creator gave us teeth so we can use them.
Yeah. Yeah. Not just for eating and all the other things too, but yeah, to make someone's day brighter. So good. Okay. So thank you again for coming on for our part 2, kind of the deep dive into the questions. We'll make sure we link the first episode where we really dove into Dr. Loud's background as well, and linking all the ways to connect with Dr. Loud. So she's an expert at Inside Life Network, but then if you are in Phoenix, Arizona, you can see her, but you don't even have to be in Arizona. You can fly in and see her. I know Ben flies in all the time to see, and like, if you have not seen Ben's teeth, like he looks like a different person right now. Like, you did a great job. Oh, well, thank you. Thanks to everybody tuning in live, and we'll make sure we get the recording out to our members and Dr. Loud's community as well. So thank you for hopping on with us today, and for Dr. Loud for joining us. We appreciate you so much. Grateful for you.
Thank you, everyone. Amazing question. Thank you so much.
Oh, good. Thanks, Dr. Loud.
Thank you.